Asian double eyelid surgery. Indentation above stitches. I had Asian double eyelid surgery and got my stitches out today. I understand I need to be patient, but I'm very concerned about the multiple creases. In particular, I'm afraid too much fat was extracted, and that is a cause for the indentation above my stitches. My surgeon told me it was a surgical tape combined with a swelling. Grateful for your advice.
Thank you for your question. You submitted a question after having your sutures removed after double eyelid surgery, and you're concerned that you have multiple folds on the left side and that there was a possibility of too much fat being removed. Well, understanding that I'm sure that your doctor had discussed with you the normal phases of healing after eyelid surgery, that swelling and wound healing is a process that takes some time. Now, I perform both incisional and non-incisional Asian eyelid surgery, and I can tell you that swelling is certainly a factor that isn't always very easy to predict. When you first do the surgery, and intraoperatively I will periodically do the surgery where I'll even ask the patient to open their eyes and I'll see how well the eyelid creases inward, and being comfortable of how it looks during surgery usually is pretty predictive of the ultimate result. So again, whether you had excisional or incisional surgery, regardless, the multiple folds can be caused by the shifting of fluid not only under the skin but actually behind or adjacent to the eye. You see, the space around the eye is called the orbit, and this fat that is reduced in order to create a crease for someone who has a monolid or a single eyelid and who wants to create a double eyelid, you have to actually enter that space and reduce in a very conservative way some fat in order to allow the connection between the eyelid and the muscle of the eyelid that lifts the eyelid, I should say, called the levator muscle. So since this is a space that is more than skin deep, you can understand that in the normal wound healing process, swelling can play a significant role. So I think that what you should do is in the short term and the long term is continue communication with your doctor. Be aware that there will be changes. In the next few weeks, it's only been since the sutures were removed that you've submitted these photos, but you will find fluctuations. You may find one day one eye is more swollen than the other, the next day it may be the opposite. Sometimes the side you sleep on, it can actually affect where the fluid shifts. So you're looking at more than a few factors that will be dynamic. Now, of course, for most of our patients, we tell them that yes, you can go back to work in about a week, but very often there is swelling between the eyelash and the crease called the pretarsal space that can be swollen and elevated and make the crease look actually high. And when you do fat removal, you can certainly get some variability. So I can't say from your photo that your concerns are not to be taken seriously, but anticipate that there will be changes as time goes on and that you should continue communicating with your doctor about your progress. So I guess the bottom line is to communicate with the doctor and observe the healing process and understand that also full eyelid surgical healing is really somewhere in the 6 months to 1 year range. In fact, the majority of our before and after pictures are taken somewhere in that time frame, understanding that subtle changes can happen over several months. So I hope that was helpful. I wish you the best of luck. Thank you for your question.